we are already, meeting. So our presentation is a little bit maybe too general for those who know us, but we will introduce a little bit our institution, and Aurelia more specifically will speak about nursing. So, as you mentioned, 10th or 11th, time being here, but as always, it's great pleasure and honor for us to be here and also to host your colleagues coming to our institution. And all of you are very, very welcome to use all opportunities. So, in Lithuania, we are a very small country, and I think New York is 4 times bigger than our whole country, and our capital is Vilnius. We are EU members, NATO and OECD, and life sciences is one of our key sectors in the country. We are from Kaunas. This is second largest city, and we are known as having very many students. We have 4 public universities, and over 40,000 students are in Lithuania. We are very young and vibrant city. And our hospital, and I will speak about the hospital later a little bit, is the largest multi-profile medical institution in Baltic states overall. So sensitive, so I apologize. And we are very proud that last year Kaunas, as the city, was included into UNESCO World Heritage List because of this modern architecture before Second World War. And we have very many beautiful protected buildings. Our university, it's over 100 years of history. We are a specialized university. We have a unity of studies, research, and clinical practice through our 2 hospitals. We have very strong international approach. Biggest hospital, Kauno Klinikos, offers world-class medical services to the highest level. And another hospital, Kaunas Hospital, it's, let's say, municipality level, multi-profile hospital as well. And we are proud to be ranked in some of university lists. We, are leading in medical and health sciences and accredited for the maximum period by the National Quality Agency. And we attract the most talented people in the country because of our, study programs. So overall, we are more than 31,000 people, but that's all together with the university hospitals and all incoming teachers and students. So we have our colleagues, professors who are full members of Lithuanian Academy of Sciences, more than 1,500 PhDs and 243 professors, and approximately the same number of associate professors. In the hospitals, we have more than 2,000 medical doctors, and student number is approximately 8,000, and 25% of them are international. Our values, respect for life, that's the main logo coming into all our presentations: community, professionalism, academicity, openness, and justice. Our structure: Medical Academy and Veterinary Academy. Since 2010, we joined together, Medical University and Veterinary Academy. In Medical Academy, we have 5 faculties, or schools, you would say, probably. School of Medicine, Odontology, Dentistry, Pharmacy, Nursing, and Public Health, and 3 pure research institutes in Cardiology, Endocrinology, and Neuroscience. And Biological Research Center serves both academies because they have this vivarium, animals, veterinary academy with two faculties, and also research institute and wildlife rescue center. And close to university, besides 2 hospitals, we also have a center for practical training, but also we are very happy to have young generations close to us, kindergarten, primary school, and high school as well as part of our community. International memberships in many associations, and we are proud to be a World Health Organization, 2 collaborating centers. So the nursing education and practices in our faculty, and earlier it started with prevention and control of non-communicable diseases. We have, strategic partnership with some countries, academic partners from over 70 different countries, and currently very intensive collaboration with Japan has started. Studies. I think a very important picture is on the top. That's part of our faculty. We last year in 2024 we moved into new building, brand new, very nice for stores building. So that's the picture from there. So with the modern infrastructure. So we have 3 first cycle, 14 second cycle, and 4 integrated study programs. 20 study programs are taught in English. We have residency programs and doctoral programs. Medicine study program is accredited according to international standards, and the same is for veterinary medicine. But actually all our programs are accredited by international expert groups. So it's not national accreditations, always we are accredited with international team. Number of the students is increasing, and we have now more than 8,000 and nearly 2,000 international students from 88 countries. And largely they are coming from Sweden, Israel, Norway, and India, and they are full-time students. It's not those who are coming for exchange visits. By programs, the biggest is medicine, second is veterinary medicine, odontology, and nursing comes right. Science, very high focuses on sciences with our 4 research institutes. And by our Lithuanian Research Council, we are viewed like the leader in medical and health sciences, and with the high international research standard and top ranks in medicine and biology. These are certain criteria according to which we are evaluated, our scientific papers and ongoing research projects. And the research areas are from epidemiological studies, molecular medicine, regenerative to health technology, and the areas is biopharmacy, neuroscience, oncology, cardiovascular research, digestive research, but it's not exclusively only these, and our nursing research fits into all of these ongoing research areas. So this is for agriculture sciences, since we do have veterinary medicine and animal sciences. So, as I mentioned, it's from molecular mechanisms to public health. It's very multidisciplinary, and we take privilege of that, being in the team. And regarding the students, we introduce research from the very beginning, from the bachelor degree. We also apply for the grants from our Lithuanian Research Council for the students to have research summer clinical practice. So we have this integration in Lithuania as well. It's not exclusively in our university. Innovations, patents as one of the indicators of research activities, and excellence through innovations. It's 3D printing, and that's the important slide regarding the hospital. And if we have, not if, when we have your students coming to our university and hospital, I think we will provide clinical placement them in this hospital with more than 2,000 hospital beds, nursing staff, doctors and residents, and it has 39 clinical departments, 5 affiliated hospitals, 9 intensive care and anesthesiology units, and 14 diagnostic and interventional units like specialized in cardiology, neurosurgery, and so on and so on. So it's really a great place for the students, and they can get, everything, neurosurgery, cardiosurgery, so these highly specialized clinical skills. Another hospital with 1,500 hospital beds. It's like secondary level hospital, no neurosurgery, no cardiosurgery, but all other departments are there, including infectious diseases, which were frontline, in COVID period. And Aurelia's Department of Nursing is affiliated with this hospital and having 5 smaller departments within the hospital.
3.
Yeah, 3.
150 beds.
Yeah, for nursing, leaded by nurses. Animal clinics, large animal clinics, small animal clinic also, but we take advantage of that, and we have the programs like, for example, therapy, so dog therapy, and it's also introduced in the hospitals as well. So we have interprofessional communication with them. So recently implemented projects with new buildings. And left bottom is our research and study facility for the faculty of nursing, where we have a nursing department, the rehab department, sports medicine, as well as being part of our school. Common projects, veterinary hospital, and also medicine and odontology departments are in process to be built. Our kindergarten, gymnasium with the students, and we cooperate with them very much, trying to do this health promotion and have a healthy community, and hopefully students coming into our programs as well. So this is, communication between the society and the state. So it's very important that we are serving a wider community and have a good partnership with the ministry and having influence. So we disseminate our scientific knowledge, offer expert insights, provide the future specialists, and trying to be pioneers in innovations. About our faculty of nursing, we are 105 teachers, but it's wider than Department of Nursing, and why faculty of nursing having rehab and geriatrics? The question is that we started historically with the 50 nursing students, and over the years we've grown up, and we have other departments within our faculty as well. So as I mentioned, we started with 52 students, and now, like last year, we enrolled nearly 400 students as first year students, and overall we have 1,001 students with all our programs. So now I will give the floor or the remote control to Aurelia to continue with the nursing education system and with her activities.
Thank you. I just would like to add regarding veterinary academy and a very friendly environmental for animals. I'm looking for care. I know how you work with dogs. We have official order from last year about dogs. You can bring your dogs in your working place. Yeah, you can. Yeah. It is not in a hospital, not in the, but not in lab, but in teaching class like your building. You every day came with your dog and be together. And I'm really very happy about this law in our university.
But I never seen Aurelia with her dog in the building.
But I'm promised.
She promised. They're very sensitive.
I would like to refresh your memories while I attend the last year about nursing education system in Lithuania and about our department, nursing department. We have 2 professors, 4 social professors, 4 teachers with PhD degree, and now we have 5 PhD students, and I'm really very happy about that. And we employ every year for part-time nurses from the hospital. They are delivered some clinical skills subjects. They supervise in clinical practice, and this number of the nurses from the hospital fluctuated every year, depend on the number of the students. Department responsible for 2 bachelor programs. Nursing can be providing in both languages, Lithuanian and English languages. This year we have really near 100 students in the first year nursing program in English program. Midwife program we providing only in Lithuanian languages, and midwife program in university in our country only in our university and in our department. Master programs, advanced nursing practice in both languages, Lithuanian and English. Unfortunately, the past 3 years, students not choosing English program, in master program. They choosing bachelor, but not choosing master program. And we have nursing leadership. It is part-time program. It's really very popular. And coming nurses already with some years experience, because according to our new rule, if you prefer to be a chief nurse or head nurse, you must have master degree. With bachelor, they can't apply for this position. And of course, we are participating, and in total, we have 627 students. And we are participating in different faculties program, like medicine faculty, we providing clinical skills, pharmacy, odontology as well. Our research, we have 3 streams for research: evidence-based nursing, spirituality in healthcare, and maternity care. And now we're performing 2 cost action, 2 international projects, and 1 national project. It's ongoing now. Clinical activities. We're providing long-term care and palliative care, and we have 125 beds and hospital to spread around of the city. 1 building in one part and another building in another part city, and we have 100 health workers in clinical part, physician, nurses, nurse assistants, psychologists, and physical therapists. But I would like to draw your attention that clinical activities is this hospital led by nurses, not by physicians. And we are trying to be, and I hope we are, nursing competencies center in Lithuania, because we are integrated studies, research, and clinical practice together. Educational system. Our children must finish secondary school. It's means 12 years. After that, depend on the results, final exam, they can to choose 2 ways to become nurse or midwife. If they pass very, very well national exam, they choose a university program. It is 4 years full-time program. If they pass not so good, they are choosing college. It is 3.5 full-time program. When they finishing university and college, they receiving the same license, but they receiving little bit different competences. And when they going in clinical practice, they starting with different salaries. And now we have a working group in the Ministry of Health, and we are trying to very clear describe which function must to do nurses with different education. It is so clear in educational system, but still not so much clear in clinical practice. And we are trying to draw this picture and to write some law. I hope when we came next year, I can tell you that we already achieved this. And after a bachelor program, our students, if they dreaming about academical careers, they can to choose a master program in our university. It is 2 years full-time program, advanced nursing practice with 4 specialization. It is in primary care, anesthesia and intensive, emergency care and acute care. When they are finishing this program, they are receiving second license. And they have 2 different licenses for registered nurse and for advanced nursing practice. But if they dreaming about administrative work but not expanding clinical skills work, they choosing 2.5 years part-time program. It is leadership in nursing, and they receiving just master degree but not license. After master programs, they can to choose PhD program. We have full-time PhD program. It is 4 years, and we have part-time program. It is 6 years. It is very competitive program. Every year we receiving from 2 to 4 places who are funded by state, but we are receiving more applicants, 10 or 11 applicants to apply for this places. Career pathway in clinical settings after bachelor programs, if they thinking, dreaming to work in community nursing, operating theater, mental health, emergency medicine, or anesthesia and intensive care, they must complete postgraduate course 6 months. Without this postgraduate course, they can't to work in these departments. These requirements. In academical field, as I mentioned, we have master program and this 4 branches in advanced nursing practice. Administrative career in university hospital, first step it is chief nurse of the department. It is for small unit, and it is requirement master degree. We have chief nurse who are responsible for 4 departments. This is the same specialization, and it is requirement to have PhD degree or to be a PhD student. And the highest position for nurses in the clinic career, it is nursing director of the hospital. It is obligatory to have PhD degree. If we're talking about horizontal career, like clinical career, you can be general practice nurses, clinical shift leader, and advanced nursing practice. It is a higher position when we are talking about clinical career, not administrative. Little bit history about advanced nursing practice program. We run program 2015. Jemiseta came 2014. And help us and constantly helping, and she is in our study committee. We create many law for this program. It was approved. We have medical norm, and our nurses, advanced practice nurses, practicing according to this medical norm. And totally we have 85 graduates. It is statistic for last year, and this year should finish 16 students. in the program. But in the first year, we have really very big amount of the students. It is biggest course in our history, 30 students, 3 and 0 in the program. And where they can to work when they are finishing our program in primary care, family medicine centers, and they providing independent consultation and visits for the patients. They are working in home care team and lead this home care team in long-term care hospitals. Anesthesia and intensive care specialization working in anesthesiology department. They providing some not very not complicated narcosis for the patients. They are supervising patients after operating, and 3 weeks ago we established one post for the nurses in intensive care for advanced nursing practice, and only advanced nursing practice nurses to take care about patients after some operations in intensive care unit. And future plan to establish working place in gastroenterology department and in endoscopy department. It is more detailed primary health care activities because this program and these nurses are very well doing in primary care. It is more clear function. Maybe I love primary care, Janisetta like, and maybe it was more easy to explain rule for these nurses in the society, and really they doing very well and recognizing also very well. And they participate in these activities on our primary health care. And challenges with education. It is still nursing education system lack some coherence in Europe countries, because in some in college, some in universities, and especially when we are talking about advanced nursing practice, it is still a lack of harmonization in the words, not in content, but especially in the definition, description. Yeah, that's a little bit about our work as open for your questions.
Can I ask, what are the primary chronic health conditions or diseases in Lithuania? Like the top 10 leading causes of death that we have here, one of them being heart disease.
Yeah, that's the same.
Yeah.
Cardiovascular disease, second is oncology, and the third is trauma injuries. The fourth is oncology. Of course, it depends on the age groups. So, but I think the first 4, it's more or less the same.
For nursing, I notice it's a smaller percentage that are enrolled in your school in the health and sciences building, and there's a larger percentage are medical and odontology. That's what it seems. Nursing is a smaller percentage in terms of students being enrolled, right?
Yes, yeah.
So do you plan on expanding that? Is there?
Yes, we do plan, because in Lithuania we have 6 colleges and 3 universities providing nursing education. And like medicine is only in 2 universities, and odontology the same. So that's why we have a bigger concentration of these specialties in the university, because nursing is across Lithuania in other places as well. So, but yes, we would like to expand, and every year we are trying. But as Aurelia mentioned, this entrance requirements to the university, they are quite high. And every year we don't know how this cohort graduating secondary school will match criteria for this entry requirement is for the university. So as infrastructure and our willingness, yes, we can, but it depends, on the marks they get from the secondary school in a way to be enrolled. And as university, we say that, we have to have the certain criteria, entering, because in other schools, it's like how to say, more flexibility with the entrance level, and in the university we are quite strict about those who can enter.
And also we have very objective factors who are not allowed to so much extent. We don't have children. It means the birth rate demography problem. It is also influence.
Birth rate is dropping.
Yeah, very much. And when we have stable numbers of the students, coming to the university, we say okay, because in other universities and other study programs they have dropped. And in our university, it's more or less stable. So it means that we are balanced against this demographical shifts.
I teach in the undergraduate program, so really quickly, how many students are in your clinicals? Since you only have about 12 part-time faculty that teach from clinical, how many students are in your clinical group? A given clinical group?
All of them. I mean, it's
but you asking how many nurses supervising students
One,
in the clinical
one group,
it is depend. In the theoretical, we have one group, it is 12 students, but when we are talking about clinical practice, one mentor, maximum 2 students.
Nice.
Yeah, because these 12 are teachers.
It is.
Yes, they are teachers in the department.
Yes,
And
they are
when
teachers,
students go
not
for
in-
clinical placement, they get mentors who are not employed by the university.
Are they paid?
No.
Oh. It's interesting because I know that some schools have now used hospital nurses as clinical teachers, not the way we do it here. We have adjuncts. So they use the staff nurse to teach. And that's what you do, right?
Yeah, we are doing.
So I know in the Philippines they are paid.
These questions, I just, before this trip, I had meeting with director of the hospital, and they asked this question, but we are trying to keep this not pay for nurses, because it is some career possibilities to be a mentor, and we are trying to follow Scotland example, because in Scotland all nurses to be the mentors, and they must to complete many courses and be very responsible mentors, and government not paying.
Yes.
If you're not a mentor, you are not receiving very good salary, you can't apply for promotion, and we are trying to keep this approach.
Yes.
But of course it is question when hospital to start very loudly to ask us to pay for that, but we will see.
I think, we still can keep that position because both hospitals are part of our university, and it's easier to find agreement. But of course, our nurse students are allowed to take clinical placements in other hospitals. It's not exclusively, Kaunas and so on. But until now, we didn't get the request from other cities, that if you send students, please pay money. So,
because it is big shortage nurses in our country as well in all the Europe, and hospitals who would like to employ young smart nurses must to be very friendly, and also this is part of affecting not to ask so often to pay for this.
I have a question about a couple of things, actually. In America, we talk a lot about diversity, DEI stuff. Is it something at Lithuania? When I talk to my European friends, they find it very strange that we're obsessing about the DEI things in the United States. For them, it's not a thing. They are aware of it, but it's not a dinner conversation. How is it in Lithuania? That's my first question. The second question is faculty development. Can you give us some example on what you do for faculty development?
Regarding diversity, well, yes, it exists. And I think for us, it's quite natural. I mean, it's, and there is no, of course, I think, well, what we assume as thing to solve is cultural diversity for our international students, and to build an environment, because they come from different countries, and how university could be, good help for them to feel, safe, accepted, and so I think this cultural diversity regarding other things, because can be anything, but we maybe we are talking about inequalities. I think this word is more frequently used in our language, and we are talking about healthcare inequalities, social inequalities to be covered. Yeah, so in a way it's.
I can imagine that the Swedes is a very different culturally than the Lithuanians, right? I mean, I don't know.
Yeah, well, we have like, we have students from nearly 90 countries. So, yeah, so Sweden is, major number in medicine, but for example, our students in nursing, they are coming from India, mainly south part, like Kerala, Tamil Nadu. So like from our perspective, the first year should be challenging for us, challenging for them, and how to make that this first year to be as smooth as possible, because it's very, very difficult for them and for us as well. So it's yes, and we acknowledge all this diversity, and we train our administrators, we train our teaching staff about this cultural diversity ourselves every time. So it's yes, it exists. And faculty development. So maybe Aurelija will add something. We have maybe different levels. How we approach. Well, there are international requirements. There are national requirements for that. Also, university does have certain procedures to do that, and department level. And how to support is, again, university strategy to do that, school level and department level. And what our university drives very much, so there are professional competencies, educational competencies, and general competencies. And during recent years, our study center established a department called like innovative education. So they provide many different courses. I think this started with COVID, when we were not able to travel, and they offered many courses online. So it's really very easy to get in and to complete the course. And another very important aspect is international visits. So in our faculty, we have quite high numbers of mobility visits going out. And in Aurelia's department, I think all teachers are traveling.
One time per year, or 100%. Yeah. And not only teachers, but study administrators as well, doing visiting abroad.
Sort of an exchange program.
Yeah, exactly. Yeah, because we have within Europe, this Erasmus mobility program is very popular, and well, not only within Europe, Aurelija and I are here because of this Erasmus mobility, because it's for non-EU countries as well. But within EU is very easy, and we have so many institutions with whom we cooperate and agreement. So it's easy for us, it's easy for our students to travel, and also we welcome the students to our university.
They also North countries network for it is for short, but it is applied only for Nordic countries. Scandinavia countries plus 3 Baltic countries, it is called Nordic countries, and we have different networks. One of very strong networks for advanced nursing practice, and also we are using this money for short mobility visits for students and for teachers as well.
Has any of our faculty, Jamie, have gone to Lithuania?
Well, I've been, what, 4 times. I've
Other than you, I mean.
taught classes there, Allison Squires.
Allison.
And Beirut.
Okay.
So welcome.
Yeah, you're
I'm just thinking about, Hugh isn't there. I was just thinking about those types of things, because I think it's a great opportunity for everybody. I know in Europe, the Erasmus program is very great, you know, send your students, but that's a great opportunity for, I mean, I don't know how it would look like, you know, for us to go there for 1 semester or something.
It's there are the opportunities, and we use any opportunity in a way. There is also Fulbright program, you know, for teachers to come, and also we applied for our Lithuanian Research Council because Lithuania supports very much international teachers, you know, coming to teach in the university. So there are different programs. So one is international Lithuanian Research Council more supports researchers, you know, with the research profile. But also there is an educational program supporting teachers. And until now, we are quite successful inviting teachers, and it's paid by the government. And our university has the special grant scheme to support teachers to come. It's not very generous, I would say, but still covering the costs. Let's say no extra salary for that,
but travel accommodation.
Yeah, it's covered. Yes.
But you want to go to Lithuania?
Yeah.
So are you going to the ICN conference in
Yeah,
Finland?
I am.
I will be there.
Yeah,
too.
or we will.
And we already made the joke that Finland, actually Helsinki, is just 1 hour away from Lithuania by plane.
Oh, nice.
So it's easy to come to visit.
It's really interesting, and you have a veterinary school as well. And my husband is a veterinarian. He teaches at Cornell pathology, and it's a big discussion about One Health. I don't know if you, not a lot of people have heard of One Health. And the veterinary medicine is very ahead of nursing. That the idea is we are all sharing one health. So the veterinarian should talk to the physicians, to the nurses, to the social. It's a very progressive way to look at health.
Yeah, in our slide on Veterinary Academy, where was this research fields, it's, you know, on the top, it's One Health. And that's the aim. And in autumn, we had the visit from WHO, European region, the director Hans Kluge. He was visiting our university, and we had a very big discussion on that, and you know, aiming that to include maybe Veterinary Academy into activities, and to have this One Health approach. And I think it's Dublin City University is nominated as collaborating center for One Health. So on WHO agenda, this is, you know, it's you know, priority topic. And for us, I think it matches very well having these two academies.
Are there student groups in the programs? Like we have student groups here that are student led, you know, one with the dermatology, one for dermatology. There's different types of student groups, emergency room nursing, emergency something. You have student led groups, like the after classes activities.
Yeah, it is a little bit different way we are doing, like you ask us. We have a students organization, and in students union, they have different branches for the activities, and all these activities in students' hands, and they really very active. They very demanding from teachers, asking different things. they mentoring, especially for first year students, mentoring, and yeah, it's very well developed in our university student union.
And so all the students are first degree, they're not, or traditional students, they're not second degree students.
Oh, we have in nursing program in every year more and more coming students who already have one specialization from sociology. It is from different. This year we have students who are many years work in policeman, and he decided to be a nurse. And they like second career. It is more staying more and more popular.
Okay.
Paramedics.
Paramedics, teachers.
You also see a growing number of males enrolled in the program. Okay, mostly female.
Oh, well, unfortunately, because it is many reasons. This history, first of all, history of nursing in the world. It is a mother, like nurses' mother and country's history and salary, because men choosing a profession where they can to earn more money. Nursing, it is not professional where you can to earn so much money.
What is the term for nurse in Lithuanian language? Is it sister?
No, slaugytoja.
Is it gendered?
Well, in Lithuanian language, you know, we have the ending different to guess is it male or female or by gender. So it's slaugytoja, it's lady, female, and slaugytojas, it means men.
I ask you because in some European countries, the name for nurse is very gendered, right? It's a
I
female.
never thought about it that way.
It used to
The
be.
German word is Schwester,
Schwester,
sister,
which
yeah.
is
Yeah,
sister.
Schwester, yeah.
It used to be.
Yeah,
It
so
used to
is-
be. We
that is
changed.
true, that's a good point.
Yeah. It used to
In
be.
Polish, I think it's gendered
Yeah.
too. So
Yeah.
it sometimes prevent the males from going into the
Yeah.
profession because the title itself is female.
We have general part words in Lithuania, and we are trying to use in our lecture, because sometimes when we have boy in the class and some boys, I am not female, I am male. Okay, sorry. And we are already to educated ourselves to use common words when we are approaching. But word sisters came from Soviet time.
Yes. I think the Soviet.
We
nurses
changed
were called
1991. 91, we changed this name.
What sort of, just in terms of like, obviously the third year of war in Ukraine, what is the impact of the war in Ukraine on the university and on the students, on the nursing sector?
Yeah, I have one colleague, Maiva, nurse. She really very active, and she organizing constantly different missions to the Ukraine and collecting staff
To go into
to
Ukraine?
go to the Ukraine, and some of our students also went for this mission. We have employers who from Ukraine, assistants, nurse assistants in operating theaters.
Research Institute, there are researchers, there are some teachers who are employed in the university.
You know, it is very difficult to
Students.
explain, to describe what we are doing. We're doing different things for Ukraine every day and every family. And it is like usual our work. To donate, to support, to try.
I have another question about the post-baccalaureate training for.
Postgraduate program, yes?
Yeah, the 6 months.
Yeah.
I think.
Mhm.
Is it done through the hospital or?
Program established by university in our postgraduate center, but of course we collaborate with the hospital. Some part theoretical, some part clinical skills, and we together creating this course. But always leader of the course from the university part.
So they attend formal lectures and then
Yeah.
the clinical portion
Yeah.
while they are employed by the hospital.
Yeah.
Mhm.
I'm interested in the critical
Yeah,
care. I teach the elective.
Yeah, and hospital sending them for this postgrad. If, for example, you are chief of anesthesia and intensive care unit and you need new nurses, you are paying, you are sending these nurses to this course and you are paying money for courses. It's few of them paying by self. It is mostly pay hospital have big interest to have this specialist.
I'm curious for the PhD students or even for the faculty, what types of research projects for their dissertations are people working on?
Yeah, it is okay. It is depend because as you see in our faculty, it is not pure nursing. We have 5 departments, but we are competing for the same PhD places. And for example, in my department, nurses and midwives, and one I now in department 5 PhD students, I supervising 3. One topic about prime home nursing care service and quality indicators implementing in the service, another midwifery care and mother health, and the last it is evidence-based nursing and how nurses are ready to implement this evidence-based in clinical practice. And we compare university hospital and all national levels of hospitals in Lithuania. It is topic. And I hope will be the new PhD students in the autumn, and we are planning to investigate palliative care model in Lithuania and which factor affecting this palliative care service expand.
Because I wonder if that's a potential area of overlap with students, PhD students are interested in similar types of research. In terms of at least collaborating or communicating, I think that'd be interesting.
We always looking because we have some obligation to have consultant, second supervisor, and it is always very good as the second supervisor international supervisor.
Another question? Thank you.
Thank you for your time.
You know, how it works. So